Hi, my name's Martin Kirk. I'm an Associate Professor in the Research School of Population Health. Today I'm going to be talking to you about public health protection, protecting the food supply. This is the third in a series in the subject MEDI8115, Fundamentals of Health Protection and Health Promotion, where I've been talking about health protection, which is a public health function of protecting the population from risk. So today I'm going to be talking about the food supply, and it's a very interesting area because it's complex. We eat food every day and we produce food, we prepare food, and many times we don't think about the actual risks associated with it and how we're protected. Health protection is a system which has developed over many years and is a very effective means of lowering the risk from disease and disablement. So, when we think about protecting health relating to food, we have to take into account the complexity of the food supply. Every piece of food we eat usually has multiple ingredients, all of which have to go through quality assurance and quality control, and they may travel from all different parts of the world. So even in a hamburger like the one in front on the screen, there may be a huge array of different ingredients in there. Today I'm going to be talking about the food supply in the context of health protection. I'm going to be talking about Australian food regulation, in particular about how we set standards. And then I'm going to go through risk assessment because it's particularly important here in the standard setting process, but also in the response, the assessing response to emerging threats from the food supply. And then I'm going to go through responding to acute events and finally summarise things. So last week I introduced a framework for health protection where we talked about related services providing important functions for protecting health that worked in concert with public health services, which planned, prepared, developed policy, regulated, investigates, enforces and audits. And today I'm going to be expanding on that a bit for the food supply. And when we're thinking about the food supply, what kind of threats can it deliver, we'll be focusing in on some of those as well. So when we think about the related services, who are the government agencies and other actors who are involved in protecting the food supply? Well, firstly, obviously, Department of Agriculture and Trade. We can have international trading partners which can enforce standards upon us that improve our food supply. Industry bodies that lobby government and encourage its members to enforce standards and improve quality. Food companies themselves that don't want to make mistakes because, let's face it, people don't actually want to make other people ill, and it can have disastrous consequences on business. And then there's non-government organisations which are involved as well, particularly in the international setting. In terms of public health services, regarding food supply, departments of health have a critical role. There are food safety agencies which often straddle ministerial portfolios of agriculture, food and economic development. We have public health units that are involved in protecting health, and state and territories often have council structures or that will also have a role in health protection. In terms of types of threats, we can be talking about chemicals, including radiation, microbial contamination, such as Salmonella or E. coli, allergens, and even adulterants, so pieces of metal or plastic. Those types of things can cause problems as well, and obviously end up costing food businesses a lot in terms of making sure that those kind of products don't end up in the food supply chain, and if they do, then recalling the products. And hopefully the processes that government and non-government agencies put in place can avert those threats through risk assessment, risk management and risk communication. So if we think about the cycle of health protection, we can think about our main aim is to prevent food contamination. Where it does occur, there's a need for a risk assessment to work out what is the likely threat from that risk, to set a standard to ensure that it doesn't actually occur, to consult industry, to coordinate the response, and then decide about the appropriate treatment or measure to prevent, then treat the food so that it doesn't actually represent a risk to the population, and then monitor compliance. I'm going to talk a bit about that cycle today. So food is vital for health. Everyone eats at least 2 to 3 meals a day, and much of the world's energy and efforts go to supplying enough food for people. The supply chain has become increasingly complex. 100 years ago, most food was produced and sourced locally, and it was consumed locally as well and produced in short supply chains. However, things have become different. There's a need to protect food from contamination of these different types of threats, as we've just mentioned, and that's largely done through development of standards and application of regulations. These standards can be national and international, and then they are then picked up in risk-based regulation. Why is it so important? Well, there's 9.6 billion people in the world, and increased consumption of more protein. The graph on the right shows the increasing number of kilotons of poultry in blue and beef in red, and you can see it's going up consistently to over 100 million tonnes per year, and there's also a change towards more processed foods, which can lead to different types of risks, and so the risks might be more associated with allergens and other chemical components that are in food. There's also a globalization of supply, which means that it's big business and there is massive movement of foods. So the movement of foods internationally has increased dramatically in the last 2 decades. This means the food contamination can occur through the chain at a variety of settings, and it can also, there's a huge variety of contaminants right through to from basic adulterants and physical hazards right through to antibiotic resistant organisms, which can go from one country to another just by virtue of the fact they travel on food. So when we're thinking about food, we've got to think about the food production chain. And this is a diagram from CDC which shows where our food comes from, essentially being produced in a primary production setting. It might be caught on a boat or grown in a pasture, or actually be harvested from a field where it's stored. Then it's sent to a plant for processing, distributed out to the food service industry, so it might be retail or it might be restaurant. It's then taken home for home preparation or restaurant preparation, where it's consumed by either people in the home or in the restaurant. And at any of these stages, there can be contamination resulting. And the further back up the chain it occurs, the more widespread the exposure at the population level. So the further up towards primary production and processing, if you get contamination up there, it can be disseminated to many, many consumers. Whereas the further down the chain you go, the less prevention benefit there is down towards home consumers, which is one of the reasons why health promotion doesn't work so well for many food-based matters. If we're just trying to influence people's behaviour, we have to work much harder to actually reap a benefit than if we work right upstream at the production setting, where if we're influencing producers to produce safer food, then there's less effort required down the chain to ensure safety. Not saying we don't need to do health promotion or other activities downstream of production, but what I am saying is that we need to work at each of these different points in the food production chain, and we need to make sure that the that our efforts are strongest right back upstream where the threat arises. So the Australian food regulatory system is brought into power by an intergovernmental agreement in Australia signed in 1991 that was recently updated in 2008. We also have a treaty with with New Zealand, and that essentially brings into play a joint food standard system that was brought into play updated in 2010. There's also the agency Food Standards Australia and New Zealand, which originally was the Food Safety Agency in Australia, and then it was ANSFAR, which was the Australian New Zealand Food Safety Authority. In around about 2000, it changed over to Food Standards Australia and New Zealand, or a bit later, and there's an act supporting its functions. So at the national level, FSAN sets the standards for both Australia and New Zealand, with some differences between them because New Zealand doesn't incorporate all of the standards, but state and territories regulate and enforce those standards, and we'll talk more about that. This is a pictorial representation of implementation and enforcement in Australia, and you can see here that there's a mechanism for input from stakeholders, development of policy, setting standards, and then finally implementation. So the food standard setting process has a consultation mechanism with consumer groups and industry groups that feed into a very high level ministerial council, a Council of Australian Government's Legislative and Governance Forum on Food Regulation, which includes all health ministers along with other ministers such as ministers of agriculture, all ministers who have portfolio responsibility for primary production and processed foods. They are reported to, they have a principal committee, which is the Food Regulation Standing Committee, which is chaired by the Secretary of the Department of Health in Australia, and has senior level bureaucrats from all state and territory departments for which council ministers have portfolio responsibility, along with local government association, as local government has a key role in regulating food safety in Australia. In terms of food standard setting, Food Standards Australia and New Zealand has a board which decides standards and represent a wide range of stakeholders, including industry, consumers and health professionals, and they have the principal role in setting standards and report to Food Regulation Standing Committee and the COAG Food Standards Committee. And then finally, in terms of implementation of the Food Regulation Standing Committee's responsibilities, we have the Implementation Subcommittee also, and so this includes bureaucrats from all state and territory, New Zealand, Department of Agriculture, Fisheries and Forestry, Food Standards Australia and New Zealand, Department of Health and Ageing, Department of Agriculture, Fisheries and Forestries, and LGA members. And so this is a committee which largely looks at how do we enforce the food standards in Australia, how do we incorporate them into regulation, how are they implemented on the ground. In terms of FSAN's objectives, their main brief is to develop food standards, and first and foremost, FSAN's has an objective to protect public health and safety, to provide consumers with information, giving them informed choices about food, and to prevent misleading and deceptive conduct. All of their standards are based on risk analysis where possible, and they aim to see an internationally competitive food industry that's consistent with international standards. And important to recognise that Australia's food standards should not be present a barrier to trade for other countries. That said, we want to make sure that consumers have the highest level of protection possible. There should be promotion of fair trading and support ministerial council policy guidelines, and ultimately have efficient regulation. So I'm going to talk a little bit about the standard setting process today, and it's important to recognise that any agency or industry group or individual even can make an application for a food standard which might permit or extend the use of a food additive or processing aid, so introduction of a new chemical to extend the shelf life, to vary or establish a maximum residue limit for a pesticide or veterinary medicine, or to introduce or vary a labelling requirement, so that anyone can do that at any time to Food Standards Australia. It has to be backed up by evidence. So who regulates food safety in Australia? Well, it really falls down to health departments, departments of primary industry, and an example is PrimeSafe in Victoria, which regulates primary production of meat in that state. Food safety agencies, which might actually answer to a Department of Agriculture or answer to two ministers, and we have an example in New South Wales of the New South Wales Food Authority. It's well worth having a look at their website. They do an excellent job of ensuring food safety in New South Wales. We also have local councils which regulate food businesses within their council area and serve a critical role in ensuring safety of the food supply. And you can see this is an example of New South Wales Food Authority website, where they're providing not only regulatory controls but also food safety advice to consumers. So lots of information right through to health promotion and putting safe food messages out there to consumers. So the standard setting process is captured in the Australia-New Zealand Food Standards Code, which sets out the requirements for food that is served and sold in Australia. And here are a couple of examples of different types of food, and all food is subject to the Australia-New Zealand Food Standards Code. So all foods produced or imported for sale in Australia and New Zealand are required by law to comply with the code. In addition, states and territories may have other standards that are incorporated into their legislation and other legislative requirements. As I mentioned before, state and territory agencies enforce, and the main reason for this is that food safety as a responsibility is devolved to states and territories under the Constitution. So states and territories have powers under law to develop regulations around this, protecting the health of the population from food. Australian Government Department of Agriculture is responsible for imported food at the border. And we're going to talk a bit more today about the Food Standards Code and the different chapters. And I know that seems like it could be really boring, and if you sat down and read it from start to finish it would be, but we're going to try and break it down by these different sectors and where it actually applies. So it'll come back to you, and because we're going to talk about the different parts of the distribution system, the food production chain. So firstly, Chapter 1 contains general food standards that apply to all foods. So labelling requirements, the substances that are added, the prohibited products that aren't allowed to be sold, maximum residue limits, and here's this, which is an example of an Australian-only standard. New Zealand has their own residue limits, and they vary. Probably not much, and probably not in a way that would affect safety, but some may have different residues they're interested in, and limits as well. Novel foods, gene technology, irradiation, and also microbiological limits. So just saying that certain bacteria aren't allowed to be found in food that's ready to eat, for instance. Chapter 2 is food product standards, which are standards that apply to specific foods, and there's a whole list here, and they've been built up over time that might have specific requirements. So, for instance, special purpose foods like infant formula will specify the actual limits of certain bacteria which aren't relevant for other foods but are for these ones. So spore forming bacteria which might be present at very low levels in infant formula, and if they are, they can actually cause severe illness in infants because of their specific nutritional requirements and the fact that they don't have a well-developed biota in their gut. So it's quite common to have these different foods which have specific standards, and many of these actually probably don't necessarily relate to safety, but may also relate to quality or aesthetic characteristics, so tastes, odours, and really come back to saleability as much as safety. Chapter 3 is Australian-only standards, which apply to food safety programs, food safety practices, food premises and equipment, and food safety programs for vulnerable persons. So here they're only Australian. New Zealand has their own set of standards and approaches to this. And this is a very important chapter because it really relates back to that step in the food production cycle, which is back at the food service area. So very much around restaurants, caterers, all of that type of area. And here's an example of who they apply to. So these types of groups. And of course, when we're thinking about vulnerable populations, you might be thinking about aged care facilities or children's services such as daycare, which might have people who are more vulnerable or vulnerable to severe outcomes of illness if they become infected or ill from food. It's important to say something about food safety inspections when we're thinking about this particular part of the food production cycle, because food safety inspections are something which, when you talk about food safety and food, that's what people think about, is an environmental health officer visiting a restaurant with a checklist of things they need to tick off that the restaurant is serving safe food. It's important, however, that these food safety inspections should assess risk-based plans. The people running food businesses need to have an understanding of the risks themselves, and people in the food service industry are trained, and in the standards it does specify how people are trained and what they should be trained about. So food businesses are required to develop risk-based plans. They are very complex though. They need to take into account food, ingredients, inputs, and all processes within the business. Food safety inspectors can request and copy documents, examine anything, food, equipment, surfaces, take photographs, videos and or samples, conduct tests, seize items such as food or equipment. It's important here to mention too that the food safety plans that food businesses prepare, and this can apply to anything from a small food business such as a restaurant right through to a multinational food business, all have to develop a risk-based plan, and they're often all modelled on what's called hazard analysis and critical control points. And this was developed it's originally from engineering constructs, and it was developed for NASA to send their astronauts into space with safe food. So they analysed the actual processes of production and worked out where the real risks were and identified the limits that couldn't be exceeded to provide safe food, because there was no way they could deal with a sick astronaut, and they can't medevac someone from the International Space Station. So HACCP, as it is known, Hazard Analysis Critical Control Point, has been used by food regulators around the globe, and it's a key part. It's not necessarily called HACCP everywhere because people have some criticisms of it, but the first step is to conduct a hazard analysis, to think through what are all the hazards that might be associated with production of the food, whether it's in a restaurant or in a factory or any other setting. Then to identify what are the critical control points, what are the points at which we can identify if something goes wrong, then we're going to be producing contaminated food, and what can we do to limit that. And that's the point at which we can measure and establish critical limits for those critical control points. They may be fewer than people realise, They may be only a couple of critical control points within a whole production cycle that really have to be controlled and critical limits established. And then finally establish procedures to validate that the hazard analysis critical control point is working, that whole process is working, because if things go wrong, then it can get really ugly and people can become ill. And hazard analysis critical control point, or HACCP, is very different from end product testing, which is what used to happen, that many years ago people would just test the end product and without much regard for what had happened during the process. People inherently had developed processes that minimised risk, but they didn't measure the points at which risk was potentially going to be introduced. So this process emphasises testing the process at which there is a critical control point, that if things go wrong, contamination will occur, and then at the end there is a process for validating that HACCP has worked. I should also point out that there's a need to establish record keeping as well. So records are critical to this whole process to make sure that it's defensible and well defined. HACCP business, some people said, have a cup of coffee and pray. Some people have criticised HACCP for the fact that you can be testing but removing the requirements of end product testing so intensively means that sometimes things can go wrong with this system as well. And I think the main thing to realise here is that it is all about being aware of the food you're producing and actually thinking through what are the risk points and making sure that you are constantly assessing the risk to consumers or the people who purchase the products. There's many different ways of regulating and managing food safety in commercial premises, and one you might hear about is scores on doors, which identifies the results of inspections and provides a score for restaurants. It's based on an inspection checklist. The only place in Australia where it's been used is in New South Wales, but only on an opt-in basis in participating councils. It does inform consumers about the safety of the foods being produced at that restaurant, but you have to ask, who uses these scores? Is it good marketing? And does it make it safe? I'm not sure that it does all the time, but one thing I do support is the fact that government is open with consumers about food safety and also the quality of food being produced at food premises. And here's an example of a food premises assessment report, and you can see here there's a range of different things that an inspector is looking at when they're going into a food premises. Everything, and this is only just a very short list. They can be huge. At the end of the day, what the inspector is looking at is going in and looking at the food safety plan or HACCP program that the food premises has developed itself and validating that it looks appropriate for the business and that all of the verification and checks that have been established are actually working and appropriate. So what is the evidence base? You have to ask, when we're talking about food safety in premises, often many of the standards that have been set over the years have come from Victorian era hygiene, and if you look at many of the inspection reports, you will see there are things like tiling must come to 3 foot 6 inches up the walls, and many of it is more around Victorian era hygiene and cleanliness than actually preventing foodborne illness. It's very difficult to develop an information basis that is truly based on risk. So many requirements on food businesses are not actually there because they're preventing risk, but more about what people think is clean and appropriate. it's a difficult area, and I would encourage any of you to think about what is the evidence base for food safety when you next visit a restaurant. Chapter 4 of the Food Standards Code is all about primary production and processing standards. It's only been introduced in the last 10 years, and it was introduced in response to perceived concerns about primary production and the fact that it was a source of much contamination that couldn't be controlled by downstream users and consumers. So a restaurant can't really deal with salmonella on lettuce or rock melon very easily. But if you could control salmonella on rock melon or lettuce up at the source, so at the farm or the factory where it was washed and distributed, there you have a chance to intervene, as we were talking about earlier in the food production cycle. So these are Australian-only standards applying to outcomes-based standards for primary production and processing industries. They're pre-harvest up to the manufacturing operations. So they include standards for seafood, poultry, meat, dairy, and some cheeses. So what are the risks? For fresh produce, for instance, there are risks that come from water, manure, fertiliser, wild animals, transport, processing, and they can cause outbreaks, and we've seen a couple this year from rock melon due to salmonella and also lettuce due to salmonella, but quite a range of others, everything from viruses through to bacteria. The food safety program should manage risk, but it is quite complex when you're dealing with a natural product like a fresh produce item and minimising contamination. When we're talking about animals, so there's been a range of food safety programs for production. You can see a couple of these are for meats, so seafood, poultry, meat, and dairy and eggs, obviously related. And sprouts I've included there because animals actually are a key cause of contamination for sprouts, which are a regular source of outbreaks of infection. And earlier this year there was an outbreak of Salmonella St. Paul linked back to mung beans. So animals are involved in all of these, but particularly the production of meat, so seafood, poultry and red meats. The risks vary by sector. Obviously poultry higher risk and that is largely due to the way they're produced. And you can see here chicken carcasses hanging up. When they're slaughtered, the carcasses are cooled very quickly in a big spin chiller, which is like a big bath that's of chlorinated water, but the cecal contents are spilled into there, and any contamination that has come out of the cecal contents end up contaminating the whole birds. And so it's really common for consumers to buy chicken meat that's contaminated with Campylobacter or Salmonella, yet they don't know it. And so there's a need to manage those risks and reduce that contamination through the chain. Eggs are also high, and we're not seeing change in terms of the numbers of outbreaks that are linked back to eggs. Australian health authorities have had concerns about egg-associated salmonella for several years now. It's worth also pointing out here we might shift into talking about risk and assessment of risk. And I've shown this diagram a few times in the last couple of weeks, which is really showing how risk analysis fits together. And it's all come out of Codex Alimentarius, which is an international standard setting body which countries can opt into in terms of accepting their standards, or they can develop their own. Australia and New Zealand have chosen to develop many of their own, but definitely participate in Codex Alimentarius, which is a joint body from the Food and Agriculture Organisation and the World Health Organisation. So it has regular meetings and sets standards which are very important for international trade, and many countries adopt their standards into their national legislation. As I mentioned in previous weeks, risk analysis encompasses risk assessment that feeds into risk management and then ultimately to communicating that risk to the community. So it's a key to public health action. So these 4 steps we will go through shortly, thinking about food, so hazard assessment, dose response, exposure assessment and risk characterisation. And I'm going to be talking today specifically about how epidemiology feeds into those particular areas. So the purpose of risk assessments is to estimate risk at a point in time and hopefully changes over time. As I mentioned previously, it's almost opposite to epidemiology, where epidemiology often deals with people who are ill and trying to work out what the cause was and what the contamination level was so they could inform future policy, whereas risk assessment looks at the concentration of contaminants and projects forward about what the risk might be to human health. They're used to set standards or guidance levels. They can rank risks by different contaminants. They can assess factors influencing risk by looking at different scenarios, develop policy, and also assess emerging risks. So in the heat of a public health threat, risk assessments can identify who's at greatest risk and what kind of scale the problem is. So just a few definitions. As I mentioned before, epidemiology is the study of health status in a given population, and it's a key to risk assessment. We're generally looking at the relationship between risk factor and illness, but we're often starting with cases of disease. So we're doing our study after the fact, when the disease has already occurred. It's not a simple undertaking because it doesn't look as simple as risk factor and illness. We may have intermediate risks that we're looking at, confounders, and so the relationships can be quite complicated. There's a need to weigh up the evidence, and it requires judgment. And there's also a variety of study types. Obviously we can use experimental designs, but they're rarely used for public health threats, and most of the time we're relying on observational studies, which complicate our understanding and are often troubled by things like confounding, bias and chance. So when we're thinking about acute health events due to food, they're often poorly understood hazards. There may be a gradation of illness, from no disease through to severe illness and death, and I'll give a few examples shortly. We may be alert from a variety of sources. We may hear about them from the media, we may hear about them from consumers, we may hear about them from the healthcare system, or even public health surveillance. But when they involve food, they result in widespread public concern. Acute health events represent natural experiments where we can learn about virulence, novel agents, reservoir source, so we get new scientific evidence. We can also learn about the effects in populations, so things like host factors, vaccine efficacy, infective dose, no observed adverse effect levels. And then we learn about the clinical disease, how it actually manifests in people, the severity and the sequelae, through to the transmission system failures, prevention measures and surveillance, and also the societal impacts and costs and benefits. So it's important we do study adverse events or these public health threats that occur, such as an outbreak or an occurrence of illness or contamination well, so we can learn about these particular events. Here's a few examples. This is from a few years ago in 2011, where Bindi's beads were withdrawn at Christmas time. Bindi's beads were a children's toy that contained a chemical that converted to grievous bodily harm, a sedative and anaesthetic drug, when they were ingested, and kids naturally put them in their mouth, and there were cases of poisoning. It's not actually a food, but it did represent a public health threat, and in this instance it was actually withdrawn under legislation from the Attorney General's department, which is all about consumer law, and but definitely a potential threat. Here's an example from a few years ago as well, where some alert clinicians noticed that people were getting iodine toxicity from drinking soy milk that was used in cappuccinos, so bonsai soy milk. And it turns out that they were using kombu seaweed to infuse a flavour into their soy milk. The kombu had been coming from China, which was naturally high in iodine, and had very high levels of iodine, so people were developing hypothyroidism. And there were many cases in Australia, and it led to a recall of these particular soy milk products and a reformulation. Another example, which I may well have talked about before, is this E. coli outbreak from a German organic farm in 2011, where there was a huge outbreak. And here you see the epidemic curve, and you can see in the bottom there with the two lots of blue bars there that these are hemolytic uremic syndrome cases. And you can see that on single days there were over 50 or 60 cases in this northern part of Germany. Cases were occurring throughout Germany, and if you think that each of those required dialysis, you can imagine that dialysis units were overflowing with people requiring dialysis. And this all resulted from a very small sprout farm in northern Germany producing seed sprouts from fenugreek seeds that were imported from Egypt. So a huge outbreak here, very severe consequences. Many people died, and 600 or 700 cases of hemolytic uremic syndrome, as well as cases of hundreds of cases of gastroenteritis. So a very severe outbreak and requiring a huge and robust response from health agencies. And this is an example of the rapid risk assessment that the European Centre for Disease Control did in response to that outbreak. It was really particularly looking at the risk to other countries in terms of their the outbreak. If we think about the health protection workflow, we have the health alert, the health assessment, and then ultimately protecting health. So in terms of health alert, we have a rapid risk assessment like that one European Centre for Disease Control did, which is illness occurring? And if it's yes, then there's a need to conduct an epidemiological and other investigations such as traceback. And if it's no, then there's a need for risk assessment. Through risk assessment you assess no, then it goes back to a watching brief on maybe need to conduct that rapid assessment again sometime in the future. And then the health protection requires a range of different things to occur. So for the epidemiological and other investigations, there's a need to do a risk assessment to work out what are the vulnerable populations, where is there a need for particular public health action, and then risk communication. For the risk assessment for standard setting, there's a need for a legislative response and a risk communication, which is slower and can take more time. So I'm distinguishing here between a risk assessment for standard setting, which is what we've been talking about previously, to a risk assessment in a public health emergency, which is more rapid and looking at what are the populations at risk and how do we protect health. Here's an example from a few years ago of cassava chips, which the Australian health authorities had to intervene with a few years ago. And cassava is a commonly consumed plant. It's cultivated in the tropics. It's a vital carbohydrate source, particularly in countries like Africa. It's cheap and readily available. But the cassava plant does have cyanogenic glycosides in the roots, and if it's poorly processed, it can actually convert through the enzymes to cyanide, and there's processing required to leach that out before it's eaten. It can result in acute poisoning with very severe consequences with people dying, or conzo, which is at lower levels where people develop a neurologic illness which is very disabling, and they can't walk and have other neurologic symptoms. In 2008 there was a health alert because Japan had rejected some chips that were produced using cassava flour that contained 59 milligrams per kilogram of cyanide equivalent. The manufacturer was Australian and they had used Indonesian cassava. The food safety authorities in Australia conducted a rapid assessment, and there was concern for children at these levels that if they ate enough they may develop some symptoms, mild symptoms of poisoning. So the response was that health agencies alerted general practitioners and emergency departments to be on the lookout for cases of cyanide poisoning and to record cases who might actually be detected. In terms of cassava chips, they conducted a risk assessment. The hazard assessment showed that there was a steep dose response from animal studies in human poisons, which meant that at the dosages where you could see an effect, it was the poison was very effective and would kill rapidly. It was different for cyanoglycosides, and the guidance level that Australian health authorities set was 25 milligrams per kilogram of cyanide, which is a 30-fold measure of safety. So there was quite a bit of safety built into that, and it was an interim measure. In terms of exposure assessment, looking at what kind of amount of exposure would constitute a public health hazard, the chips they determined had a mean cyanide level of around about 64 milligrams per kilogram. So a 20 kilogram child would have to eat over 100 grams of chips to exceed the reference dose. In terms of descriptive epidemiology, there were no cases of illness detected, and the legislative response was to put in place a standard of 10 milligrams cyanide for cassava chips. However, some food safety authorities around the country disagreed with this because they argued that the cyanide present in the chips was bound up, and it was not there were some problems with the analytical method. It was applied at the border on chips coming in, and consumers were advised to limit consumption of these products. Another example is an international outbreak of hepatitis A in 2010. It first started here with a multi-state outbreak with local cases in Victoria, and they conducted an inconclusive case control study. A South Australian study showed that there were semi-dried tomatoes linked to illness with odds ratios of 5.7. They had a single cohort where a caterer had used semi-dried tomatoes, a single brand, and they were able to recall those. The recalled brand was just from semi-dried tomatoes produced in Victoria. Oz Foodnet then conducted a multi-state case control study which showed strong association with semi-dried tomatoes, and the tomatoes were hepatitis A positive, but it was an experimental test conducted in France. Traceback was very complicated, so this is where food safety agencies trace back the ingredients of foods that consumers had reported, consumers had reported, to work out where it had originated from. And they did identify that it was associated with a single supermarket, but they couldn't identify a single brand. So they issued consumers warnings not to consume. All returned to normal until October that year, and there was another increase in cases, predominantly in Victoria, where they conducted another case control study, and there was again a strong association with eating semi-dried tomatoes, and particularly those at cafes. the tomatoes were imported, they were able to identify a single brand, and they conducted a food recall, which is a critical tool in food safety regulators' armament. So where there is a contaminated product, they can require a food business to recall their product, and they did that, and they also issued an emergency order in the state of Victoria to cook all semi-dried tomatoes before consumption because of the complexity of the supply chain, that semi-dried tomatoes may end up in a variety of different products. In total, there were over 240 cases, 45% of people hospitalised, and 1 fatality. So big and serious outbreak. So in review, there were 3 case control studies, South Australia, multi-state, and a Victorian one involving over 600 cases. There were laboratory notified cases and population-based controls. In terms of exposure assessment here, they used a 2-month window for foods eaten, which shows how difficult it is if you think about trying to recall what you ate for the last 2 months. And they tried to capture brand and location where possible and conduct individual traceback. They were able to estimate odds ratio of exposure for over 40 different types of fresh produce, herbs and spices, and demonstrated a strong association with semi-dried tomatoes. In terms of a risk assessment, the food safety agencies conducted a risk assessment and showed that hepatitis A is a hardy picornavirus with moderate consequences. In this instance, there was a high hospitalisation rate, with many people ending up on the liver transplant list. In terms of dose response, hepatitis A has a very low infectious dose, and it's difficult due to the long incubation period. The exposure assessment, 16 to 28% of people were exposed in the community to semi-dried tomatoes, but certain groups were more likely to consume. They also detected RNA in the food, but it was an experimental test, as I mentioned. The risk characterisation, there were certainly some high-risk populations, including those that received blood and plasma, and the Red Cross in this particular outbreak decided to ask people whether they'd consumed semi-dried tomatoes in the previous 2 months, and if they did, then their blood was rejected. There was temporal association with products from Turkey and international spread. In terms of the international investigation, there was an international outbreak alert issued to European and North American networks, and also a network managed by the World Health Organization of Food and Agriculture Organization, the InfoSan, the International Food Safety Authorities Network. There was also a notification to the international health regulations to inform other countries, and about a year and a half later, France reports an outbreak, or it was actually about a year later, France reported an outbreak with semi-dried tomatoes. There was some informal viral sequence sharing amongst Europeans and Australian laboratories, and the Netherlands had the same strain as well, and they identified a case control study. They conducted a case control study and identified semi-dried tomatoes. WHO InfoSan coordinated the response and conducted an investigation in the exporting country Turkey, which found no problems, which is quite common in these internationally distributed foodborne disease outbreaks, and they also summarised the outbreak. So where does epidemiology and public health come into play in these risk assessments? In the hazard assessment, epidemiology is able to answer, has illness occurred, conduct systematic literature reviews and case studies. In dose response, it's able to identify how different levels of exposure related to illness. In exposure assessment, it's able to identify the prevalence of exposure, who is at high risk based on exposure or susceptibility, and in terms of risk characterisation, it can validate risk assessment results and assess likelihood and severity of health effects. So in terms of in acute events, it's important that epidemiology is quick because there's an imperative to intervene and prevent disease, particularly relating to food, because it's a potent source of delivery of pathogens and contaminants to people. It also allows for improved recall of exposure. There's a limited window of opportunity. But it also needs to be clean, because epidemiology has to convince government, industry and the public. There's been many examples where early data has damaged investigations and really weakened the case for public health. So it's important to get things right. The social and economic costs of foodborne illness is significant, and it's quite common for businesses to go out of, to go under because of foodborne disease events. There's also the use of epidemiological findings in court and inquiry, and ultimately what's most important is that good investigations influence policy. So what can epidemiologists and public health practitioners do? They should be consulting risk assessors and managers early, including toxicologists and other health professionals. I would encourage you to learn about risk assessment and management, and understand that they have a central role in decision making outside of population health, and they're often not considered part of population health. Gather data to fulfill gaps, and as I mentioned before, these acute events represent natural experiments that we can learn more about how they affect populations and health. Recognise the importance of outbreaks to process improvements in food, and I think for that reason it's important to document carefully foodborne disease events and share data. And regulatory agencies need to increase their understanding of epidemiology and population health. There are clear differences in jargon, which is an impediment to communicating. But as I mentioned, acute events and natural experiments. Regulatory agencies need to ensure that acute events are investigated well to fully characterise the risk and dose response relationship. It leads to better health protection and improves risk assessment. There's a need to simplify reporting and ensure timeliness, and I think consult epidemiologists. It really comes back to good communication. There are many challenges for risk assessment in acute events. Certainly short time frame in days or weeks. There's an urgent response, and it's quite common in food settings to have this, where there's high level political interest. There's a need to prevent further illness. There's always uncertainty around exposure. It's often non-specific. People might know they've eaten semi-dried tomatoes, but not what brand or where. Dose response. People often don't realise how important that is when they're investigating, so it's important not just to find out whether someone ate semi-dried tomatoes, but whether they ate 1, 3, 5 or 10. And then degree of contamination. There's obviously issues around testing. It's difficult to actually have tests which can quantitatively identify contamination. I've mainly talked about these issues relating to contamination, but I think it's also worth thinking about, should health protection measures be extended to sugar, salt, fats, allergens? There's certainly going to be consideration of these things into the future. How do you think health protection measures could be extended to these other contaminants and commodities? So in summary, health protection for food is developed over the last century, which has had to deal with an increasingly complex food supply chain. There's still a need to minimise exposure to acute or emergent hazards of infectious, chemical, radiological or biological nature through food. Health protection makes the food supply safer. Thanks very much. Hope you enjoy your next meal, and think of all the ingredients, where they've come from, how are they protected by regulation and standard setting, because it's a complex system that works together to make sure we can enjoy food. Thanks very much.